So I will start and I will call Mr. Daniel DIACONU as Bucharest, as host nation, is appropriate, in my opinion, to speak first. So, Mr. DIACONU, if you like, I give the floor and control of the presentation over to you. You may start. Thank you.
Good afternoon again. Proposal for military medical research from Bucharest perspective. This is the short content. And I would start with a small introduction. The therapeutic approach of Romanian hospitals in SARS-CoV-2 infection is in a continuous dynamic as the clinical observation on a large number of patients, as well as the medical research offer more and more information, treatment, and diagnostic tools. Compared to the beginning of the pandemic, today we have at hand in the treatment of COVID-19 increasingly effective therapeutic approaches. Military medicine is proving, especially in these times, with a strong social, economic, and health impact. That is a profession that has all the attribution to adapt to the needs of society, people, to be efficient, transparent, and close to the beneficiaries of the services. Burnout syndrome before and during the COVID-19 pandemic. I would like to say in recent years, interest in burnout has increased, being a syndrome more and more common in developing countries and with an increased impact in both personal and professional life. Healthcare personnel represents one of the most exposed professional categories in this syndrome due to overtime, desire to treat all patients, fear of failure, inability to suffer from certain pathologies, and of course exposure to additional factors in the workplace like physical, biological, chemical factors. According to the study conducted between May and June 2020, there is an increased level of burnout of healthcare personnel, the highest score being obtained by doctors. There is also a gradual increase in the level of burnout proportional to aging, but slower than before the pandemic. The percentage of burnout reported by sex groups is close, with no significant differences between men and women. But even in this case, there is an increase in the incidence of burnout in the last 4 months. Burnout syndrome remains a common problem in the health field, especially affecting doctors, probably because they represent a complex interface with patients, relatives, the rest of the staff, doctors from other specialties. To decrease the incidence of this syndrome, but also its effects, it's important to apply various means of prevention, such as identified and combating the triggers factors, observing and early intervention on the disease, and treating the effects produced by it. On this basis, we conclude that stress and exhaustion and distress lead to the development of burnout syndrome, which in this period, breaking what should be the first and most important rule of any medical practitioner, the safety of the rescuer. If so far the focus has been on saving patients' lives, during the COVID-19 pandemic, there is now a growing understanding that some patients are facing long-term consequences of SARS-CoV-2 infection. In the almost 2 years since the onset of the medical crisis, numerous clinical data have been accumulated on the medium-term effects of COVID-19 on the human body, which has led to the emergence of a new syndrome called post-COVID chronic syndrome, which is a condition that includes all clinical, radiological, and laboratory manifestations that persist or develop after the disappearance of SARS-CoV-2 from the body. Also, weakness symptoms such as severe fatigue, persistent muscle ache, headache, or shortness of breath may persist for weeks. Patients with persistent symptoms after 4 weeks of illness suffer from what specialists have called long-term COVID or long COVID. Based on current information, it's not possible to accurately predict who will become a long-term COVID patient. But the following risk factors appear to be important for long-term COVID, like age, gender, especially to women, obesity, asthma, patients with 2 or 3 chronic diseases, and the most common symptoms or affected systems after 2 weeks are general fatigue and physical activity, respiratory symptoms, neurological symptoms, cardiovascular, metabolic disorders, and of course psychological symptoms. It's important to note that it's always necessary to consider whatever changes in mood are primary manifestation, secondary changes related to the long-term effects of COVID, or a disorder of adaptation not yet well, with the feeling that COVID-19 it will never pass. The concept of this center is to make a complete medical evaluation in a dedicated space with dedicated medical staff, an evaluation that consists of medical examination, internal medicine, pneumology, cardiology, neurology, computer tomography, and overall, at the level of our hospital assessment center, there are specialists who, in a first stage before diagnostic post-COVID-19 syndrome, eliminate another cause for the persistence of symptoms. The people infected with SARS-CoV-2 can be symptomatic or asymptomatic. Keeping in mind that asymptomatic people discover often the disease by chance, the percentage of asymptomatic people infected is unknown, but according to epidemiological studies that took place, it seems like these people can spread the virus as well. The Central Military Emergency University Hospital started the screening of the personnel at the ending of March 2020. Firstly, with the people that had direct contact with people that had COVID-19. Secondly, with the people that were sent to Role 2 field hospital. People that came from vacation and Once quick tests were internationally recognized, the screening took place weekly to the entire personnel of the hospital that were not vaccinated or people that were not naturally immunized. The main objective was to calculate the percentage of hospital personnel that got tested with the PCR method or quick antigenic SARS-CoV-2 positive. Considering the low percentage of naturally immunized people to prevent the spread of the virus on the workplace, there is a big importance to increase the percentage of vaccinated employees or maintaining the number of tests for the unimmunized personnel when the community spread is high. These days, the Army is increasing its ability to fight COVID-19, and two diagnostic medical centers opened in Bucharest and Pitești. The activity of the diagnostic medical centers consists mainly in receiving, sorting, basic investigation diagnosis, and establishment of the therapeutic plan, directing the patients to COVID-19 health units. The Medical Directorate of Ministry of National Defense, with the support of the force categories and support commands, provides the medical staff that service these centers non-stop, and the sanitary pharmaceutical materials, medical and sanitary materials and equipment necessary for this operation of CMD COVID-19. Like a conclusion, I can say, starting with December 2019, people around the world have started a tough, endless war with a tiny and unknown enemy, this virus, SARS-CoV-2. And in Romania, the first case of illness with this virus appeared on February 26th, 2020. And so we joined this war. In the first line, this time, it was no longer the military, but the medical staff who didn't hesitate and fought non-stop for the good of patients. Being a new virus, whose origin